All right, well, it's 5:03 by my clock, so we're going to go ahead and get started. My name is Dr. Ana Gonzalez, or Dr. G, as students call me, and I want to welcome you to our town hall for students and our families. I am the Vice Chancellor for Student Affairs, and this afternoon I am joined by our senior leadership for Student Affairs and Academic Affairs. They'll introduce themselves shortly. First, I want to thank you all for joining us this afternoon, and make sure that you know how to submit the questions during this town hall. You'll notice that we've given you the ability to ask questions via the Zoom Q&A feature that's at the bottom of your screen. Some of our professional staff and university senior leaders are helping to field these questions. Those are the panelist screens that you see, our student affairs or others with names that are not actually, you can't actually see them. You see their pictures or the words that say student affairs. In addition, we all have the pre-submitted questions, and we're going to do our best to answer as many questions as possible over this next hour. So if you're in the Zoom Q&A feature, you may see us dismiss some questions. Please don't be alarmed. We use the dismiss function to remove duplicates from the list, and we'll do our best to answer these questions live. So to make sure that you know how to use the Q&A feature, please go ahead and share the place you're watching from, and I'm going to go ahead and name some of these places on air. So if you go to the Q&A, just tell us where you are watching us from. New York City, Cincinnati, North Richard Hills, Texas, couple from Cincinnati, California, Boston, Philadelphia, El Paso, Texas. I like this Earth, yes, thank you. Well, thanks everyone, I appreciate all of that and love the engagement and the humor. So finally, I want to say that this town hall is being recorded. Later this week, we're going to upload this town hall to the families.wuchtel.edu and the studentaffairs.wuchtel.edu websites. Finally, I want to thank all of my colleagues for joining me today. We have some extraordinary members of our community with us, and I'm so grateful for their commitment to our student experience. I will go ahead and have them introduce themselves now. Starting with Cheri, please.
Hi, everyone. I'm Dr. Cheri LeBlanc. I'm the Executive Director at Habif Health and Wellness, our student health center here on the Danforth campus.
Hello, everyone. My name is Kawanna Leggett. I'm the Associate Vice Chancellor for Student Affairs. I work with the Office of Residential Life and the First Year Center. Look forward to chatting with you all this evening.
Hi, I'm Jen Smith. I'm the Vice Provost for Educational Initiatives. So I'm here representing my colleagues in academic affairs, and as also a professor of geology, I appreciate whoever recorded that they are participating from Earth. Well done.
My name is Rob Wild. I am the Associate Vice Chancellor for Student Affairs, Dean of Students, and Chief of Staff to Dr. Gonzalez. And I also, for the purpose of this call, I work with several offices, one of which is Campus Life, which involves student groups, fraternities, sororities. I know we have some pre-submitted questions about Campus Life that I'm happy to answer. Thank you, everybody.
Thank you all. Again, I want to thank you all participants for being here and being in communication with us and sharing with us all your questions. We're going to try to answer them as much as possible. I also want to thank you in advance for the grace that you are continuing to give all of us. This is not an easy time for us at WashU and our country, and I hope that all of you are continuing to be safe wherever you are Zooming from. So with that, I'm going to go ahead and ask the first question. This is going to go ahead and go to Dr. LeBlanc. I received an email from UPS regarding free testing kits. Is this email legitimate? What if my email from UPS has the wrong current address listed?
Yes, this is a legitimate email. It is the company that we have partnered with to send all of the students here in the United States their kit for their pre-arrival and entry testing. If for some reason that email or that address is incorrect, we are going to encourage you to find any test wherever you are to do a pre-arrival test. And then certainly these tests are going to be available on campus. So for when you get here to do your entry test, you can pick one up here on campus. There'll be various locations in the duck and other areas on site.
Thank you, Dr. LeBlanc. The next question, I'm going to switch over to our academic colleagues, Dr. Smith. The university has said that all courses will be taught in person starting January 31st. Can students choose to return to campus but participate in courses remotely? What does the process to request approval for remote learning look like?
So once we return to in-person, we're going to be in person for courses. I mean, the only mechanisms we've had for students to study, to participate in classes remotely, have been tied either to travel restrictions or visas, which thankfully has been much less of an option recently, or in rare cases for specific health conditions for which vaccination wasn't possible and put students at particular risk. I mean, but that was allowing people to study fully remotely and not come to campus. And so our process wouldn't cover somebody who wanted to be on campus and participate in everything else, but not go to their classes in person. So we are not offering the option for students to elect to participate in their courses remotely once we are back in person.
Thank you. And as a follow-up for that, just to, if you can share, the current virus situation is concerning. And again, there was a question on, do we anticipate that students, that the issue of virtual learning will continue beyond that date? And, or do we anticipate students could continue the remote study after the January 29th? If so, when will we know?
So we will be following our medical professionals' advice on whether or not we need to extend any remote activities. But honestly, the remote coursework, we shifted to remote coursework not because we were concerned about the possibility of transmission in the classroom. This was more about being able to delay on repopulating campus. I mean, over the entire time we've been teaching during COVID, there have been 0 instances of COVID transmission within our classrooms. And so going to class is one of the safest things that you can do in terms of COVID exposure. And so if we are able to be back in on-campus operation, my expectation is that we will be in person in classes. Now, I want to make sure everybody knows, yes, if somebody is positive for COVID or is, fails their self-screen and is awaiting results of a COVID test, absolutely, they will have excused absences. There will be lecture recordings for them to access. Their faculty will support them with any courses, any classwork that they miss. And so when I'm saying, no approvals for remote learning, that's saying, to just be indefinitely in all of your classes remotely for the rest of the semester. That's what we're not doing. But of course, it is critical that students not come to their classes sick, and our students following those guidelines is, I think, why we have been able to make it this far with safe classrooms. So we don't want that to stop in any way, shape, or form. But basically, we want our students to be in the classroom as long as they are not sick.
Thank you for that. Thank you. The next question is going to be for Dr. Wild. My student is very concerned about safety in the dining halls, as students, faculty, and staff often sit for periods of time unmasked and socializing even after they are finished dining. How will this be addressed during the time of Omicron, both in the dining halls and other buildings where people congregate?
Thank you. That's a great question. And again, to be back in person, we are going to be together as a community with students, faculty, and staff together on campus. And that means in our libraries, in our fitness centers, in our classrooms, in our dining halls, in our dining spaces. As all of you know, one of the more risky activities during the Omicron spike has been identified as being together unmasked, which happens when you're eating. Our dining team at WashU has been a part of the reason we needed some of the extra time to prepare for the return of students, was to prepare our dining experience. Our dining halls will be open, there will be seating. There may be some limited seating to start the semester as we monitor conditions on campus, although it's winter, so there will be seating. We likely will have more grab and go options for students as we prepare the semester. And again, all of us are going to have to follow as expeditiously as we can the masking guidelines. And it's likely we're going to have some additional masks even available for the community as people are coming back, just to help folks with that. But our dining halls are going to be open. Students will be eating together. Again, I just want to highlight again, part of our mitigation strategy here is the mailing of tests. We're trying to, for students who may have COVID, we would like them to stay home. We don't expect that to be thousands and thousands of students, but enough to be able to keep people from campus who may be spreading COVID. But we will be ready. We will be ready in 10 days.
Thank you. The next question is going to be for Dr. Leggett. Again, about dining, but this time it's about reimbursements. So will students be reimbursed for housing and dining for the 2-week online period? If so, how much is the reimbursement? Does this apply to off-campus students with meal plans too? How will this work for meal points?
For students living in residential life housing who do not return prior to January 28, the university will offer a partial credit for housing fees, and more information will be provided in February. So I just want to distinguish that as for our students who are living in residential life housing. In terms of dining and meal plans, students will have the opportunity to change their spring 2020 meal plans and actually will be able to do that through January 31st. Those students living in residential life housing, again, who were not able to return to campus until January 28th, will be offered a partial credit for dining fees. If you're living off campus, that you would need to contact dining services to change your meal plan. But for residential life students who are not returning until January 28th, you would receive a partial housing and dining credit.
Thank you for that. Dr. LeBlanc, I have 2 questions for you. One is, there's been a couple of folks that again have asked, where will the test kits be on campus? That's the first one. And then, so after you answer that, I'll ask the second one.
Yeah, it's a great question. And I have to be very honest, I myself have not been in charge of deciding where the tests will be available. My understanding, and Dr. Wild, you may know more than I do, is that there will be several locations in the DUC and at other various places across campus, but I cannot tell you the exact space at this moment in time.
Yeah, we will be announcing those as early as Friday, but certainly by Monday. There'll be space in the DUC, the Danforth University Center, where kits will be available, as well as on the South 40 for students to be able to pick up if they, for some reason, didn't receive a kit or their test was damaged or not usable.
Great. And second, and possibly related to that, Dr. LeBlanc, what should we do if we do not get the test by the 21st? Can you review the testing procedure with the test kits?
Sure. So if you don't receive the test kit before you are going to leave to come back to campus, we're asking that you find any available test in your community and to use that test. What students should be getting sometime later today is an email that is from the university that will have a direct link to be able to upload the results of your test. So there's going to be pretty detailed instructions in that email, but basically if you are using the test, and I just happen to have your kits, they'll look like this. If you all want to know, this is the on-go kit. That is what is arriving in the mail. So if you have that, we're asking you to follow the directions there, download the app to do your test, verify your test results through the app, and then take a screenshot of that particular test result, open up your survey in your personal email that you will get, and you just follow those directions. It's about 3 different steps, pretty quick and easy. You say what your test result is, you upload your picture, you attest that that is in fact your test and it is a true result, and you submit it. Then that comes to us here at the university. Students will then get an automatic email back from us, depending on what the result of that test is. And so we'll have directions on what to do if it's positive, what to do if it's negative, and so on and so forth. Pretty detailed instructions. And so for all you parents, I'm going to ask you to try and please ask your children, and I have children this age, so I know, but please have them try and read these emails pretty thoroughly, because almost all their questions are going to be answered in the email. And with so many thousands of students testing at the same time, it's going to be very difficult for us to answer all the questions individually by phone, by email, however they would like. And the odds are the answers are in those emails. Dr. G, I forgot what else you asked me.
No, that was it. Can you show the test again? There's a couple of folks in the
Sure.
chat. You can just show it.
This will work. This is what the test kit will look like. It's by OnGo. There are 2 tests inside here, and there's very detailed instructions on how to download the app. And the app walks you through step by step on how to do this. I would say if you have problems with the app or the test, there's also customer service. I can't help you with that, unfortunately, but there will be, there's a customer service number to call. And if for some reason you don't have the test, it just is a bum test for some reason, please try and find another test. Remember to try and get a test pre-arrival. We are not mandating this particular test. We just need a test. And then if you can't get that, come and pick something up as soon as you arrive and do your arrival test with the kits that we will have here. Okay.
Perfect. Thank you. Back to Dr. Smith. I have an academic related question, which is, will students have additional time to add drop class without penalty? And what about other academic deadlines?
So we extended the add drop deadline for the undergraduate programs, and some of the graduate programs followed suit for 8 additional days. So the Friday at the end of the 3rd week of the semester, February 4th. I'm not sure what other deadlines. I mean, at the moment, the deadline for switching to pass-fail remains at the 7th week of the semester, and the deadline to withdraw remains at the 12th week of the semester. So given how far into the semester those deadlines already are, we have not changed them. Of course, you know, we've had to in the past, when conditions changed, we've had to adapt. And so, you know, that possibility remains should circumstances warrant. But at the moment, a 8-day extension on add drop is the deadline changes that we've made.
Thank you. The next question is for Dr. Leggett. It's about housing. I'm excited to live on campus again. What is the new timeline for the 22-23 housing registration assignments, and how has the current situation impacted that process?
Well, we are very excited to welcome you back to campus next year and many others. We have had to make slight adjustments to our timeline just to respect that students are at home, and we want to make sure they have the opportunity to connect with their friends in terms of our grouping process. We will officially kick off housing selection on February 1st, and the application will close February 14th. So we ask that you please get those applications in, and we'll be sending more information in soon about the process and the timeline.
Thank you. We're going to go on to some student activities question. This is with Dr. Wild. Will there be any restrictions regarding any student activities for the spring?
Good question. So in person for us on January 31st also means in person for student activities. It is very likely that at some point next week, we will announce some what I will call transitional restrictions that relate to the size of events as well as food at events. But we are planning as we go through the semester, we are already working to plan larger events, in-person events, commencement in May. And so we believe, based on the science we're seeing around this current spike, that conditions will continue to allow us to do more and more in person as we would have been doing in the fall. But we are going to be in person for student events on the 31st, and we know our student groups because we're talking with them, are already planning those events. I do want to put in a quick plug. Our student union, our undergraduate student government, did a nice job of quickly pivoting when they learned the news of the university's remote start to change our activities fair. And I like what they did. Instead of pushing our activities fair, which is where student groups advertise themselves for membership, it's normally an in-person event. And so pushing that back to do it in person, we're holding it virtually this Friday from 3:30 to 5 p.m. So 2 days. So for students who are on the call or families who have students, encourage your students to check out our spring activities fair, one of the great kickoff events of the spring for students to get involved in one of our over 400 student groups here on campus that are continuing to eagerly recruit new members.
Thank you for that. I'm going to go back to Dr. LeBlanc. One question will be on boosters, and the next is about students who've tested positive. So the first question is, many peer institutions are requiring boosters. Why is WashU not currently requiring a booster, and are there any plans to do so in the near future?
Thanks. So anticipating this question, because it has been a common question, my colleagues and I on the COVID Medical Advisory Group discussed this once again this morning. And I'm going to read my answer because I want to be sure that I'm representing this group to the best of my ability. And it's not an easy answer to explain. So I just want to be sure that I'm getting this as clear to you as I possibly can. So if you see me reading, forgive me. All of the physicians on the COVID Medical Advisory Group believe that on an individual level, boosters give strong protection against severe disease and death from COVID-19. And we strongly recommend that everyone who is eligible get boosted. As a physician advising an individual patient, we all encourage it and want to make it easily available in case one does not have access to it before coming back to campus by having booster clinics available the first 2 weeks students are back. When we put on our public health hat, things are a little bit different, and we make recommendations for the safety of a community and not just an individual. So when vaccines first became available, it was clearly evident that in order to have an environment where we could safely engage in person back on campus, this was one of our most important mitigation strategies that needed to be in place. And mandating that particular vaccine was a pretty easy call. Now, as we look at the benefit of mandating a booster versus strongly recommending it, it's not quite as clear. We expect that about 70 to 75% of individuals will get a vaccine when it's recommended versus the 95% that we expect when it's mandated. So studying the efficacy of the booster from stopping transmission, especially with Omicron, it's been clear that boosters don't stop Omicron transmission all that well. And many who are boosted will still get infected. Again, why it's so important on an individual level to get your booster, because if you're infected, your risk of severe disease, much less if you're boosted. But the incremental decrease in transmission on campus, if the campus was mandated to boost, is not nearly as potent as it was in the decrease in being immunized in the first place. So when we look at recommendations for safety of our community, it was felt that the grounds for mandating the booster are far weaker and are not outweighed by the need to respect individual and physical autonomy in this instance. So hopefully that's given you a little bit of an idea of how we represent this. Individually, as my patient, I can advise you one thing, but as a public health official, we look at it in a different way. So that's the answer that our group has come up with to give to you, Dr. G, and hopefully have been able to explain it a little more clearly to the parents who are listening.
Thank you so much, Dr. LeBlanc. And again, really special thanks to you and the rest of our doctors who are balancing out and doing the, helping us think through these policies and at the same time, really doing the healthcare for our community members. So thank you. I want to ask, actually, the next question is for you as well. It's going to be groups of COVID related COVID questions, specifically for those who've been infected. Will students who were infected with COVID-19 during winter break be exempt from entry testing requirements? And if a person had COVID just last week, but no longer symptoms, and at the same time they test positive, because they've heard that up to 90 days, you can have up to 90 days. You can still test positive after having COVID, but they're no longer symptomatic or contagious. Is WashU treating all positive tests the same and requiring quarantine until they test negative? That was a mouthful.
Yeah, but that's okay. So to answer the first question, or the first part of this question, and keep me on track, Dr. G, if I forget something. Students who have tested positive for COVID-19 from January 10th onwards are exempt from our pre-arrival and entry testing. What we ask is that you contact our nurses at habifnursing@woostel.edu and upload your positive test. And again, after January 10th, if you've got a positive test, we expect everyone who's positive to then isolate and do what is expected for those who are positive. So here at WashU, our isolation is 7 days for a positive test. We expect you to follow with your physician or healthcare provider in your community to take care of yourself, to be sure you're doing well, to be sure you're recovering. End of isolation, you need to be fever-free for 24 hours. Your symptoms need to be reducing or not there. And it needs to be at least 7 days from the time of your symptoms start or the time of your positive test. So we chose January 10th as a cutoff because the test that we are using here is an antigen test. And what our studies have shown in antigen tests, that they do actually revert to negative by most of the time by about 7 days. So we picked January 10th because some people are coming a little earlier because they have to. It's a little bit random, but it is there. And so we are not treating every positive the same. Those who tested prior to that, though, an antigen test, unlike a PCR test can stay positive for up to 90 days. Antigen test, which is what we're asking students to do, by and large, should not be positive after 7 days. So if you got Omicron mid-December onwards, up until about the January 10th, by the time you take this test should be negative. We want to be sure that you haven't been reinfected, that there isn't anything else going on. But for those recently infected, there is a process to be exempted from this particular testing because it's not going to be helpful for you. We assume that you've tested, you're following the directions, you're going through your isolation, and that you're coming back to campus when you're healthy and ready to engage. Was there something else too, Dr.?
Oh, that was great. I actually followed that through. Thank you. There's a clarifying question. There's several folks that have been asking about the dates with regards to signing up to get housing. So Dr. Leggett, can you clarify about the dates and that no one can sign up to get housing for next year until after February 1st?
Correct. So the original process was to begin on January 4th. but with the university's decision to pivot and not open until January 28th, we've made a decision to delay our start of the housing selection. So the application will actually open up on February 1st. We did communicate this to residential life students on Wednesday, January 6th in our email that talks a little bit more about the process. And so officially housing selection will kick off on February 1st.
Thank you. Dr. Smith, I have a couple of academic questions. The first is, can you share with us if there's been any study abroad programs that were canceled? And also, how does WashU's commitment protect students studying abroad through the exchange program? That's the first one, and I'll ask the second one after that.
So as far as I know, all of the programs that we vetted and approved for spring are currently going, and students, we had encouraged all of our students who were planning to study abroad to enroll in classes just in case, so that they had a backup, and we're maintaining that option for them until their program starts, so that they're able to make a decision kind of at the last possible moment. But I have not heard at the moment that any of those programs have been canceled. Our International Travel Oversight Committee and our COVID Medical Advisory Group collaborated on a review of each of those programs and really understanding the capacity of those programs to support the medical needs of our students should there be a spike like the one that we've seen in COVID cases. So basically, we planned for the scenario under which we approved study abroad to go forward for the spring involved circumstances like the ones we've been going through. And so we're confident that all of the programs that we've permitted our students to go on are capable of providing the kind of support for students' health that we would want for any and all of our students. So keeping fingers crossed that things continue in that manner and that our students will be able to enjoy their semesters abroad.
Great, thank you for that. The next question is probably one. We've heard from at least one professor that the entire semester will be taught remotely. Are all classes required to be in person at the end of January? And related to that is even if, if you could answer that first, Dr. Smith, that would be great.
Sure. So there are a very small number. So some of the graduate and professional programs are offering some courses fully remotely. So I wouldn't be surprised if that's what you're talking about, but I'm going to answer thinking that you're probably talking about an undergraduate course. There's a very small number of faculty that have been approved through HR for their own, based on their own health needs, to be teaching remotely for the entirety of the semester. Now, as far as I know, that is pretty darn uncommon. I've only heard of a small number. And then I'm aware of one professor, one visiting professor in arts and sciences who's actually stuck in Israel. And so I know his class is fully remote as well. So I can think of a handful, but out of 1,500 undergraduate oriented courses, I am not aware of very many. So that the vast majority should be switching or should be in person. Yeah.
Great, thank you. And then so far the last one about classes, but I'm sure we'll get more. Even when class is back in person, is it possible to have classes recorded so that students can watch lectures again?
So we have extended the expectation that lecture format classes will be recorded and those recordings made available. We are not expecting discussion seminars or labs or studios to be recorded, because viewing those recordings doesn't necessarily give a student all that much engagement. And so faculty are working with students in those kinds of classes to figure out how they would make up absences, but we have continued the expectation that lecture style classes will continue to be recorded. And I will follow up on the remote class. I'm getting some more information about that, so I will learn more.
Thank you.
Yeah.
Dr. Wild, I got a couple of questions for you, and with regards to student activities, what facilities will be open to students? Will they arrive on campus? For example, library, rec center, etc. And I have a follow-up question for you about career services.
Yep, everything that was open to students when they left at the end of December, everything's open now, and everything will be open when students return in a week or so. We have done a couple things in this 2-week interim period to limit some of the hours of some campus facilities, but even our libraries are opening back up to later evening hours. The fitness center will be open, the Danforth University Center. We are expecting to be in person, and so our campus spaces will reflect that.
Thank you. Can you talk a little bit about career services and recruiting? Will companies be allowed to recruit in person, or will there be continuing to be recruitment virtually?
I was afraid you were going to give me a question that wasn't quite in my wheelhouse, but I will do my best. That's a great question, and I think anybody who knows recruiting, either if you've experienced it as a student or if you're a parent or family member on the Zoom who works at a place that recruits on college campuses, knows that one of the great silver linings of this pandemic has been that we can do a lot of recruiting virtually. That companies can interact with students, we can hold virtual career fairs, and in fact, many companies that have historically come to campus have moved, even as the pandemic conditions got less severe, to much more of a virtual platform, which in some ways gives students more access to more employers. However, having said that, we know that face-to-face recruitment still has a place in this world, and we do expect, as this semester opens, that we will open our campus to employers that want to visit Washington University and meet face-to-face with our students. That will happen, and we look forward to welcoming employers to our campus.
Thank you. Dr. Leggett, I have a question for you about residential life. Are students only able to access their own residential buildings? Will there be guest restrictions? And will there be any restrictions on gathering size inside the residential halls?
In the fall semester, we actually allowed students to visit each other between residential communities. And so you could go visit your friend in another building. We didn't have necessarily restrictions like we did last academic year, where you could not go into the residential communities. We do have restrictions in terms of space, though. And so we are very mindful that if you have gatherings over 8, it depends on the location. 8 to 10 has typically been our guidelines, and we just want to make sure that folks know that the rules in terms of public health guidelines still apply. So you want to ensure that you have masks on and that you're able to keep distance when possible. Now, going into the spring semester, we have not put in any restrictions just yet, but we are working with our medical advisement team to ensure that if those guidelines are needed, we can make adjustments. But right now we're planning to have the same guidelines that we had, which was open guest policy for students as in the fall. But we will certainly monitor the situation and update our students as they come in on January 28th.
Thank you. The next one is for Dr. LeBlanc. And speaking of monitoring, I know that we are looking at numbers in terms of infection rates and really this recent spike that we've been having with Omicron. Can you talk a little bit about the spike in St. Louis and in our region, and perhaps when the medical group are thinking that it might start going down?
That's a great question. And it is certainly one of the things that we are watching very carefully. And our state has absolutely been hammered by Omicron, like so many other states. And we are still having astronomically high numbers in the community, though the most recent data over the past few days is encouraging. And so those of us on the monitoring committee are happy to see that it looks like we may actually be reaching our peak and beginning to come down. We're waiting. One of the sites we watch most carefully is updated every week, and that will be tomorrow. So it will give us a better idea of where that is. Our hospital rates, on the other hand, are still climbing. And it's not all that unusual. If we look at what COVID has done, often the rise in cases precede a rise in hospitalizations, right? And so they decrease. It'll take longer for our hospitalizations to decrease, and they still are certainly rising, but we are hopeful as we look at how many and quite how quickly they're rising one week to the next is beginning to look better. So, you know, we're all tired. We're all pessimistic about this pandemic, having lived it for so long, but we are cautiously hopeful that things are beginning to look better. Within another week or so, we'll have more data.
Thank you for that. I know I'm thinking positive, folks. So the next one is actually for Dr. Smith. Is it your expectation that music and other performing arts programs and classes will resume on time?
That's the hope. Absolutely. I mean, I know at least some of the music classes have been set up to be operating remotely, and I believe they were setting up a remote studio in case there were people, you know, in the area that could come in and kind of be by themselves in the remote music studio and be communicating remotely with their instructor if that was, you know, what they needed to do for you know, access to instruments. So I know they've been setting up for the next 2 weeks, but with the expectation that they would be back in person with the rest of us on January 31st. So that's the expectation. That's the hope.
Great. Thank you. I'm going to give this question to Dr. Weil to give Dr. LeBlanc probably time to get water or something if she needs to. So a couple of questions. One is, if a student has emotional distress because of in-person only option, what if that option is causing them serious emotional distress?
Man, that is a great question. And I think for right now, the thing that we've all of us here at WashU have been focused on the most is our students, and how can we make decisions that help support our students. And what's so hard about this is, you know, we have students who are expressing to us that their emotional well-being is being harmed by not being here in person. We hear that, we understand that. And like the question that Dr. G asked, we also know that we have students who are very anxious about being back in a more dense community and are trying to figure out what the right decision is for them. What we're trying to do here at WashU is be super transparent through this webinar and through all the things that we're sending out about what life is going to be like on campus, so that you can make decisions that are in your best personal interest. Whenever I hear the word distress, it makes me nervous. And so what I would just say, if you or a friend or a child or somebody is really struggling, regardless of how they're reacting to the pandemic, that you reach out for support. Cheri works with a team in Habif of professional counselors who are here for our students and who have virtual counseling options if students are not comfortable being in person. I also want to put in a plug for something that you all keep hearing about called Timely Care, which is a really nice app. I know we've been talking about apps you can download, but if you are a student and you haven't downloaded the Timely Care app on your phone, lots of great health information about services through Habif, as well as mental health services if you would like to talk to somebody. And if you really are struggling with being back in person and being in the classroom or being in a lab, you know, I know Dr. Smith would say this as well. please talk to your professors. Please speak to your academic advisor about your situation. And is there a way, that the way that the classroom is organized where you can sit in a space where you're further away from other students? I know our faculty have been doing that throughout the last year and a half. And I know that they will certainly, if they're able to provide some accommodation within the classroom space itself, they will work to do that. That's a really important question. And the theme here is don't ask us how we can help you.
Thank you. I'm going to give this one to Dr. LeBlanc, and it is about where are students expected to quarantine if they test positive, and have we increased quarantine beds?
So we have had isolation and quarantine space available all through the last semester on campus. And it's in the Millbrook apartments on campus. And Kawanna can tell more about that if we need to. So here's what's going to happen. The most recent guidelines that we are following as it pertains to quarantine and isolation are this. If someone is not vaccinated, they have an exemption for medical or religious concerns, or they are not boosted and are eligible to be boosted, they will be asked to quarantine on campus if they have been exposed to someone. There's a difference between quarantine and isolation, and I think a lot of people kind of get those words mixed up. You quarantine if you are exposed to someone with COVID. You isolate if you yourself are positive. So if you have been exposed and you have not been boosted, or you have an exemption, you will be asked to quarantine in our quarantine space on campus for 5 days. If you live in a double room, we are doing what is called a post-exposure test on day 5 to be sure that you're negative to be able to go back. Okay. If you are positive and you live on campus, we will have you isolate in our isolation quarters in the same area in the Millbrook apartments. They're 2 different parts, but you will be asked to isolate for 7 days. And I know this is different than what you've read on the CDC website and what you may have in your own community, but our physicians were pretty clear that they weren't as comfortable with having our folks go back to double rooms and be back in dining halls just 5 days after they had been diagnosed with COVID. Yes, the vast majority are no longer infectious by 5 days, but there still are some. And it was enough that we felt, being able to come to you and say, we are creating a safe space, or as safe as we possibly can here on campus for your children. We are expecting our isolated students to isolate for 7 days. And that way, we feel much more comfortable with them back in the community, back in the classrooms, back in dining halls, and so on. And so that's something that I think you all need to be aware of. It is on our websites, but it's a little different than what perhaps you might have in your own community as far as isolation and quarantine.
And just to add a little bit, we have a dedicated quarantine and isolation team that has been working. This is year 2 of quarantine and isolation housing. So they are working closely with Habif Health and Wellness and Dr. LeBlanc's team. We also have dedicated dining services as well as transportation services. And so we feel very confident that we have a great quarantine and isolation staffing and plan. We have added some contingency bed space. But in comparison to last year, we are in a much better place in terms of our quarantine and isolation numbers. But definitely want to thank our staff and teams that work closely with Dr. LeBlanc's team to coordinate our quarantine and isolation housing.
All right. I'm going to next do what I call my little speed round, because we have about 9 minutes. So Dr. Wild, you're going to get a group of questions. First one is, will fraternity and sorority recruitment be virtual or in person? Have any plans for graduation changed? And will there be wild?
Okay, try to be fast. Okay, we are still doing sorority and fraternity recruitment. Because we felt it was important in working with our students to do it in person, we did move back the timeline, so that will be starting for students who are interested in that in February. And so that will be in person. Commencement for those who are graduating or have family members who are graduating. We are excited to welcome all of you to our campus on May 19th and 20th. It's going to be awesome. We got a little practice last year with planning commencement during a pandemic, and we were super successful. We had a great 2 days of activity, and we expect it to be as great this year, if not better. We're going to be in person. We have a new kind of food celebration outdoor thing we're doing that's going to be fun. And so get excited about that. And then Wild, if you don't know what that is has nothing to do with me, but it is a large event tradition on our campus where students gather on the last Friday of classes in the spring to enjoy some live music in the quad with friends. And we've started the planning process for that. The students responsible for that have started working to plan that event. And as of today, we are planning to host an in-person Wild, the first since 2019 in April here on our campus.
Thank you. Dr. Smith, a quick question. Is there plans to change spring break or anything on the academic calendar?
No, we are keeping spring break, and I'm already looking forward to it. No, just kidding. No, we are definitely keeping with the academic calendar the way it is currently set up. I should say we did take a page from past years, and we instituted a no exams or major assignments due on the days following university breaks. That was similar to what we did with wellness days last spring. We hadn't done that in the fall, but we adopted that again so that we are hoping to protect the break times for as much relaxation as people can get. So keeping that in place.
Perfect. Thank you. Dr. LeBlanc, 2 questions. One is, will the university provide free booster shots for faculty, staff, and students? And B, will students be allowed to take free testing if they have symptoms or if they believe they may have been exposed?
Yes and yes. I'll tell you a little bit more. Yes, we're having 2 weeks of booster clinics. The first 2 weeks back on campus. And I believe hopefully your students, unlike my daughter, who's a senior, did not ignore my email about this. But an email went out last week to tell you all about the COVID booster clinics coming on campus. And there is a link in there where students can sign up. I still really encourage you, if you're going to, to boost before you come, because that way, if you get exposed and right from the first day you're here, you won't need to quarantine. But there are free clinics available starting the first week back, and it will go for 2 weeks, Monday through Friday. So yes, for boosters, and yes, for testing. There's always been testing available. There always will be. Anyone with symptoms, worried about any symptom, even mild, we encourage you to reach out to us or the COVID call center, which is what you would find as a student on your self screen. If you say, yes, I have a symptom, it will tell you. And I don't have it up. I could demonstrate, but I don't have it on my phone up, but it will tell you to call that number. They will order a COVID test for you. Those have always been here. They always will be. We're also looking at trying to increase some of our optional testing, and more details about that will come as we kind of operationalize that a little more.
Great, thank you. I think this might be for Dr. Leggett, but maybe LeBlanc or Wild. Students living on the South 40 have tried to register for the free COVID test, but have been rejected, saying it is a business address. How will students be able to receive the 4 free government tests?
I have gotten this question not only from students, but from our staff as well. We have been in contact with our mail services and UPS to coordinate a clear answer on that. But we have gotten that response as we actually have live-in staff who that is their permanent home. And so they've ran into that same problem. So we're working with our mail services team to come up with a coordinated answer and response. And we will certainly add that to our FAQs and make sure that that's in our future residential life communication.
Thank you. Dr. LeBlanc, if you can clarify, if my student is already on campus, do they have to take the return to campus test?
Technically, no. So I know it's confusing but if you are already here on campus, the requirement is to have at least one test. So you can email, you can reply to the survey and use it as a pre-arrival, or reply to the survey that'll come a week later for your entry test. So technically, if you're already here, that pre-arrival doesn't really mean much. So just at least do one and submit it.
Great, thank you. We are running that's about time. We are going to keep these questions just to let folks know, and we're going to do our best to continue to answer this. Before we go, and I know there's so many questions, I hope that you answered a lot. And before I conclude, I'm going to ask each panel member, starting with Dr. Smith, and then Dr. Wild, Dr. Leggett, and Dr. LeBlanc, if they can say just a quick thought in terms of how our students and families can continue to thrive during these, what we know is our difficult times right now. So Dr. Smith.
I have been through, so I'm teaching an intro to earth science class with 120 students this spring. And I have to say that the humor and engagement that we had between my co-instructor and I and the class yesterday at our first class was incredibly rejuvenating. And so, taking joy in the things that we still can, and even if they're not what we hoped or expected they would be necessarily at the time, still finding those ways to connect and those ways to have fun with each other, I think is trying to stay positive.
Thank you. Dr. Wild.
Like Dr. LeBlanc, I also have a student at Washington University, and he's a first-year student in engineering, and he was really pissed off at his dad when the university announced on December 30th that we were going to be remote the first 2 weeks. That was a hard 24 hours. But what we've talked a lot about is just, try to get back connected with the student groups that you were connected with. He's already been doing that. Somewhat virtually, and so they will be back in person. So they're already planning for their activities after January 31st. Just staying connected with those friends. He's been able to get together with some friends here in St. Louis from WashU. I think that's been helpful. You can still get together with other people during a pandemic. We've all learned that. They're just, when there's a spike in cases like that, like we're experiencing right now, you got to get boosted. You got to encourage your friends to get boosted. You got to wear a mask when you're indoors, especially when you're with people that you don't know. And so trying to just remind of that, but being together is okay. And I think being together is what's going to help get us together at the end of this thing.
Dr.
I echo many of the thoughts of my colleagues. I will say that we miss our students. And so delaying starts and not starting when we expected for everyone to return, that is hard for us as well. Two of the most positive experiences that I've had over the last 2 weeks has been when I've engaged with students. Last week, we welcomed back a small group of students for orientation who were joining us. And that was just great to see them. We had to transition to virtual, but they were all so resilient and excited to be together. And then this past Saturday, we kicked off our spring RA training. And so to see our RAs getting back and ready to be back on campus to welcome students back was so engaging. And so I just say thank you for your patience and your grace that you're extending. Check on each other, reach out if you need support. We're here for you all, but we can't wait to welcome back our community. And we've gotten through this. We had a really good fall semester, and our students continue to impress me with following our mitigation strategies we have in place. So I know that we have so much hope to continue that for the spring, and just wish you all well. And hopefully you're enjoying your virtual class experience right now.
Dr. LeBlanc.
Well, what can you say after all of this? But I would just say that as the physicians look at what's happening here in the state, and I know it's been very difficult to delay coming back. I really truly believe it was the right decision for our campus. We are looking at the numbers right now, and it really does look like they're going to be coming down. And so giving us all that time to let the community settle and get you back, I think is a real positive, and it's gonna be able to get us doing what we want to be doing on a regular basis here. I would say as a parent, and looking, trying to support your child, take it one day at a time. It's an old cliche, but I got to tell you, this has been a very, very long pandemic, and when you try and look at it in the big picture, it can be very daunting. So take each day as it comes. Call your student, let them know you're there and you support them, and know that there are very many people on this campus who are here to really be supportive for your student, not just the people on this panel. And absolutely, I know these people on this panel, and they care deeply, but there are many. And if you're concerned, please reach out.
Thank you. Thank you all panelists for your time and your talent sharing that with us. Thank you all of our families and our students who are on this. I truly appreciate the grace that you're giving us and you're giving one another. And I want to just say that I hope that you are giving yourselves grace during these difficult times. We are working hard to bring you here. We want you here, and we will be bringing you back here, all of you, in a week and a half. And so I'm looking forward to seeing you all back on campus. I certainly will be here that weekend to welcome you. So again, student and family members, we hope that you found this session helpful, and to our students in particular, really, I can't wait to see all of you when you come back here. Finally, you can find this recording of the town hall at families.wustl.edu, as well as on the Division of Student Affairs site at studentaffairs.wustl.edu later this week. If you have additional questions, I encourage you to email us, whether it's families@wustl.edu or our COVID email or the Student Affairs email. And so just wanted to say thank you again for participating. We look forward to continued engagement with all of you, and have a good rest of your evening or morning, wherever you're at. So thank you.